Kennedy, who is part of Lucy's team, who's come this evening to help as well. Welcome, Richard. Right, we've got 21 people, so shall we begin now? And then if others join us, they can catch up or watch the live stream later on to catch what's gone. So what we're going to do this evening, it would be great if people could keep themselves muted at the moment, just so that reduces the background noise and everybody can hear. What we're proposing to do is Mike is going to run through a presentation that will give you some of the key points about what the proposals are at the moment, where they are, what we're doing, why we want to do it, and what's going to happen next. What will probably be the easiest is if people can keep their questions until the end of that, because I think there might be some stuff in the presentation that will answer some initial questions, or pop your questions in the chat if you would, or worried you'll forget, or you'd rather do that. Then after that, we'll open up for questions. We've already got some that have been sent in, but we'll open up to people to ask questions, or we will pick up your questions from the chat if you don't want to ask them in person. So if everybody's happy with that, I will hand over to Mike to run through the presentation.
That's great. Thank you, Abby. Are you going to be able to share your end? There we go. Maybe we can go full screen. Down on the bottom. That's it. Make it there. Hopefully everyone should be able to see that now as a full screen. So I'm just going to take you through some slides. And as Abby said, more than happy to take questions, but please at the end, because we do think a lot of the questions that arise will crop up on this. So if we can move through the presentation. Thank you, Abby. So it's an opportunity and part of our continued engagement and communication to let people have their say on our proposals about developing new health centres. A few thanks before we begin. So community groups that have supported us in engagement and communication. We have SOAR, Fir Valley Community Hub, Shipshape and Health Watch Sheffield. So thank you so much for your effort and for your teams that have helped gather the comments and help share information with communities so far. So tonight we're very clear that there's been no decisions have been made and we're here to listen. A little bit for clarity, NHS Sheffield Clinical Commissioning Group are the lead organisation on this, and the CCG, NHS Sheffield, we purchase and organise healthcare on behalf of the population of Sheffield. So again, just to be clear that no decision has been made. This is not a consultation because we don't have formal plans upon which we're consulting. So it is not a consultation. What we're going to do is talk you through proposals and then we can work on through some questions. So a little bit about our current thinking. We have been awarded £37 million to build up to 5 new health centres. This is government money, it's from central government, and it's part of a programme where we're also doing some work to develop in smaller extensions on 8 further practices. And what we're looking to do is use this to create the opportunity to transform health within the city and bring together a number of GP practices into each of our proposed health centres under one roof, and to be able to deliver some of the services in facilities that are fit for purpose and for modern healthcare. The proposals originally came from GP practices working together. The proposal went to central government and it was awarded. So we're having to play a bit of catch up, but this is really where we are at the minute, and we've had to be clear that we've got a viable case to actually start the communication with, and that's why we're having these discussions now. And we've got 15 GP practices maybe interested in moving into the new buildings across 5 possible centres. So currently we have 1 in city centre, 2 in Shire Green, Firth Park, Southey Green, Parson Cross area, and 2 in Burngreave, Pittsmore, Fir Vale and Page Hall, Foundry and separate primary care networks as they're known. So a little bit how we've identified the sites, because you'll be aware that we have sort of shared the locations that we proposed to work on this. What we'd ideally have liked to have is a range of sites and more sites than we have. But we worked very closely with practices and with Sheffield City Council, and we assessed a total of 37 sites, of which 28 were considered suitable for putting to a formal assessment process that was undertaken by the GP practices that were relevant to that particular location. Sheffield City Council and also NHS Sheffield colleagues. And the greatest weighting of that, so more importance of the opinion of that, was given to the GP practices, twice that of others. And we, of those 28 sites that we scored, we have now got 6 possible sites. We looked at how close those practices were to existing communities and patients and existing practices. The size of the site had to be available, big enough to be able to build what we were proposing or what we thought we'd need as an outline. And it had to be available. Now, clearly, space is already allocated for housing and for green space, and it needed to be in council ownership, ideally. We did push the boundaries to look at some other pieces of land. But we also looked at public transport access, and we found it really difficult, particularly within SAPA and Foundry networks, of finding suitable pieces of land that met all of the criteria and were on existing public transport rates. So we've worked really hard on sites, and the practices have too. Okay. So a little bit about the proposals for Foundry Hub 1 and 2. So 2 hubs would be created, and that's just a view of the practices that we'd consider moving, are considering moving to a new hub, and really want your views and the views of their patients. So we've got Herries Road, Firth Park, Upwell Street, Page Hall Medical Centre. The Flowers Health Centre is part of Foundry, as is Winco Bank Health Centre, and they're what's called lift buildings. So people may be aware they are new buildings that were created. There's no proposal to change those. So those practices that operate from there will stay exactly the same. We will make some improvements to those buildings to get better use out of them. And then working back up the right-hand side, Pittsmore Surgery, Burngreave Surgery, Cornerstone Surgery and Sheffield Medical Centre. Okay, so the proposal for Foundry Hub 1, we've got 4 practices that are considering moving into the new building, want the views. That's Pittsmore Surgery, Burngreave Surgery, Cornerstone and Sheffield Medical Centre. And there are 2 possible locations, one on Spittal Street next to Sheffield Medical Centre, and one on Catherine Road near the school. And it's not that we have all of those practices would move to one of those sites, because if Burngreave Surgery, for whatever reason, through consultation, it doesn't go ahead, it would just be Pittsmore, Burngreave, Burngreave Cornerstone, which is their branch, Sheffield Medical Centre at next door to Sheffield Medical Centre. If it's all 3, then the site the only site that's appropriate for all 3 would be Catherine Road. So that's the only difference we have within those that particular hub. Thank you, Abby. So the proposals for Foundry Hub 2, we have 3 practices that are considering moving to a new building, want the views of patients. We have Herries Road Surgery, Page Hall Medical Centre and Upwell Street Surgery. Herries Road is a branch of Burngreave, and we know that the locality or the proximity for the proposed hubs, it might mean, depending on where patients who currently attend Herries Road go, may come to Foundry Hub 2, they may go to another hub. So it's not all of those patients, it's those that we would expect that live closest and would want to come to Foundry Hub 2. But we do only have one possible location, and that's on Rushby Street. There's a piece of land at the end of where the school has been built. Thank you. So the proposals for SAPA Hub 1 and 2, again, some of the buildings that we've got Southey Green, the Healthcare Surgery, Melrose Surgery, Buchanan Road Surgery, Margaretson Surgery, Norwood Medical Centre, and I'll just mention Norwood in a moment, Shire Green Medical Centre, Barnsley Road Surgery, who have actually decided that they don't wish to be part of this proposal, but they are within that network. And we're very mindful that patients who attend Barnsley Road Surgery, some of their primary care network services might be delivered from a new hub potentially. Elm Lane Surgery and Dunwick Road Surgery. The thing you just notice about those is a lot of those are older properties, they're converted properties, formerly houses, and they're not really suitable for delivering modern healthcare and have in some cases, significant space constraints. Thank you. So the proposals for SAPA Hub 1, we've got 4 practices considering moving into a new building, what their views of patients. That's Shire Green Medical Centre, their main site, Elm Lane Surgery, Firth Park Surgery, Dunwick Road Surgery, part of the Green Cross group practice. And we have looked at all available land in this area. We only have one viable location, and that's on the site of Concord Sports Centre. We are working with Sheffield City Council, because they do have a proposal at some point to redevelop Concord Leisure Centre, and we're looking how we can really gain some benefit from that for the community, and link those potential developments. But again, just to be clear, no decision has been made to build any of these, and we're really seeking your views on that at the moment. I will just mention again Norwood Medical Centre. They are within the proposal. They have got an option to move, but their position so far has been all the way through is that they would prefer to stay where they are and expand, and that's been factored into some of the geography and the assessment of sites. They do have an option, and that's why it is included within this community engagement process so far. So a little bit about SAPA Hub 2. 5 practices considering moving to a new building, want their views of their patients. The healthcare surgery, which is the branch of the Green Cross group. Buchanan Road Surgery, Southey Green Medical Centre, Melrose Surgery, and Margaret's Surgery. Again, 2 branches, again, so not whole main branches there. And we have only got one viable location identified for that. A lot of the land that we'd originally looked at has been allocated to Sheffield Housing Corporation for housing, and some of that is under development currently. And that's Buchanan Road, Wordsworth Avenue, near the main Asda junction. It was originally intended to be one of the locations for future lift building going back a number of years. So these things do tend to come around again. That site is still available. And proposals for city centre. Now we only working with the bottom 2 practices, City Practice and Mulberry Practice. Devonshire Green and their branch at Hanover have withdrawn from consideration for moving to Hub. They wish to remain in their existing premises. So we are currently working on proposals to develop within the city centre. Thank you. So a little bit more, just Clover City and Mulberry. Location is yet to be confirmed. We are working with the Sheffield City Council as part of their Future High Streets programme. We're assessing availability of buildings, and we had originally got a location. It did change, obviously, with Devonshire Green and their branch at Hanover deciding to stay where they are. So again, no decision has been made. We're at the early stages, and we're trying to identify possible sites for the city centre hub. So a little bit about why we think new health centres are needed. Many of our GP buildings are old. They haven't had investment for many years in many cases. We're working in some of the most deprived areas of the city, and people do have more health needs. So we want to invest this money. This is new money. It's not recycled money or taken from another budget. It is allocated to Sheffield for the purpose of creating these new health centres in these areas. Many of the buildings are old, converted houses, and are unable to achieve modern standards, both in terms of ventilation, of lighting, of accessibility, and just the size of some of the spaces that we're looking to, we need to deliver modern healthcare. The latest advancements in technology, they lack space in waiting rooms, consultation rooms, and space for other services that we need to help improve people's health. I think the other important point is having buildings that are attractive to staff to come and work in, and making sure that in these areas we can recruit and retain the very best staff. And for some practices, owning a property becomes a barrier to a GP partner or becoming a GP partner, especially in deprived areas where property values are lower. And there's an expectation on partners to buy into property, and that is becoming a real barrier. And equally, we know we need our buildings to be more environmentally friendly, and we will be achieving the very highest standards called net zero carbon on the new buildings that we would take forward. So a little bit about what the health centres could look like inside. These are pictures of examples that have been built elsewhere, the models that we're looking at. reception area. You can see an examination room with 3-sided couch access, and a consultation room, traditional desk with a 2-sided couch access. We see very bright, light examples, and we're working on a principle that, you know, if it hasn't got a window, it's a cupboard. So we're not looking at lower standards than you'd expect than in our facilities. And a little bit on the outside. Outside space is really important for many aspects, both for patients, for feeling a sense of worth and value, and community presence within our buildings. So wherever possible, we're very keen to create welcoming and useful external spaces. I think that's really important for our buildings. I should say these are examples that are bigger than the buildings that we're looking at. So don't think they're quite going to be as big, but they will be equally as ambitious and welcoming and buildings in the community. So a few facts. I know there has been some misinformation circulating on that, and I really want to be very clear about this. Practices do not have to move. There is no compulsion, no mechanism that NHS Sheffield have to make practices do this. It is the schemes have come forward from practices themselves. We've worked with them at every step to develop the proposals and the plans, but it isn't an easy decision for them. There's a lot of factors they do need to factor in, but practices don't have to move. Practices are not being asked to merge. No, there are no mergers proposed through this process. If any practice anywhere in the city wants to go through a merger, so I think we maybe have 1 or 2 a year that do, there is a separate formal process that they would have to go through. So there are not suggestions of super practices and all the practices in the same building becoming one, completely unfounded. There's no proposal that says that. We're saying that any money that's saved from building new centres, and we will save quite considerable money on paying rent because the buildings will be fully funded by central government money, will be reinvested into better GP services. There won't be one telephone line for the centre, and I know a lot of people have had issues getting through to practices, partly because they don't have the most up-to-date telephone systems, line capacity, etc. But also, they've had to work very differently during the pandemic. What we're very clear is practice identity will remain. Individual practices will have their own number, as they do in their own staff. So just to confirm, the new centres will be in public ownership, and they'll be in the ownership of Sheffield City Council. So we're using a mechanism that gives a capital grant from the NHS to the City Council as the local authority to own and operate the buildings, and for the GPs, the practices, to be tenants within those buildings. So the benefits: there will be bigger, better spaces to provide care. We're looking to bring services together and improve your care. We will look to create easier access to buildings, and that isn't always about distance. Accessibility is far more than distance, but we do recognise distance from existing practices is an issue, and we really want to hear people's views so we can work on that as far as we possibly can. There'll be child-friendly spaces. There'll be spaces for community events and services, money advice, exercise groups, etc. We're looking to have pods where people can access the internet. We know that in some areas there's very high levels of digital exclusion. People don't either have the equipment or the knowledge and support, or the data connection to be able to access modern healthcare services. So we really want the hubs to be a point where people can actually join other colleagues and be supported to access those spaces. We want to use the space to improve health facilities for local people and tackle health inequalities. More space to attract and employ more staff. Space constraints are a real issue for many practices. We want better ventilation to reduce the risk of infection, very important. And we want to make sure that our buildings are dementia friendly, they're fully accessible for anyone with any impairment or disability. And we have the very latest standards in there. What we're looking to do is make sure that we can arrange services or work with practices to minimise the number of times that people need to travel to that particular centre, to try and do more services in one go. And really want to treat the person, not the ailment, by having the right services located together. Thank you. So some of the concerns that we've heard. People feel that they will have further to travel for some people. Absolutely, we understand that, and harder to get to by bus. as I outlined when we were talking about sites, we've worked really hard to try and find, if we had ideal sites on existing bus routes, we'd be at the front of the queue to use those. But it is easier to move a bus route or to change a bus route than it is to find an existing site available on an existing bus route. People are worried about changes to their practice, and people are worried that they will have to re-register. We may not have the answer to all of these questions, but we want to work with people to look further and how we can address them and how we can minimize those concerns. But absolutely, people will not have to re-register with their practice. The analogy has been given by some practices. It's like moving house. They'll move to a new address, but it doesn't change who they are. So what will stay the same? You will stay with your practice. Practices are not being asked to merge. You will see the same doctors, nurses, receptionists, and other staff as now. There'll be face-to-face, telephone, online appointments still be available. The core opening hours for GP services will remain the same. What we'd like to see is those buildings open on an extended basis, evenings and weekends potentially, for other services, for wraparound services, for community services, and perhaps some sessions hosted by voluntary sector organisations as well. What could change? It could be further to travel if you need face-to-face appointments, but it could be nearer for blood tests, for scans, for counsel services, for talking therapies, for physio, for money advice. We haven't determined the list of everything that will be provided within the health centres, but we really want to make sure that we can improve accessibility. So an example that's been given is if a practice has a particular service, say IAPTA, or talking therapies, on a Tuesday in one practice, a Wednesday in another, Thursday in another. Why can't we provide that and make sure people can access any day of the week that suits them, rather than the day in which that service is available within their practice? Same for physio, for pharmacists. We want to improve accessibility by bringing those together into a mass where it can be provided on a more substantive basis to make sure people can access it at the times that they meet their needs and when they're going to the building in any case. So more services will be available in the same building as your practice, and we'd like to see longer opening hours for some services, not about making GPs work harder and work longer. So has a decision been made? No, categorically not. There are many stages to go through. We want to hear from you to help with developing the plans to shape them. The location and which practices will move haven't been decided. They are suggestions at the moment. We need to hear your views and your comments. Practices might stay the same. Absolutely, you know, that's a very real outcome that the practice decide. Having taken all of this into consideration, heard your views, they stay where they are. So no decision on what services will be in the health centres, no decision on which practices will move, and no decision on the number of health centres. It could be 0, it could be 5. So we're genuinely at a very early stage. While we've had to work up something we can have a discussion around and know what's viable and what we can deliver and is affordable. We really want your views as to whether you think this is the right suggestion, and if there's got concerns, how we can modify our plans to help address those. It's a difficult decision for practices. Really do understand that. I spent a lot of time with practices and fully understand how difficult it is for them. Confirming so many, considering so many points that they need to take into account. So the next steps, we will take what we've heard to develop the options. There will be a formal public consultation, assuming that we get through comments, and we can work these through, share those with practices. Those practices that say, yes, we want to be part of that, it will go to a formal consultation process. And at that point, a decision will be made. So that's the end of presentation. What we'd really like to do is go to questions, if that's okay with people. I'm sure there'll be plenty. What we're going to try and do is be as fair to everyone who raises their hand and then come off mute to ask their question. And we will also capture comments in the chat as well, and do our utmost to cover those that we can within the time that we have available. Is that okay?
Thanks, Mike. It would be helpful if people could keep themselves on mute until, if they want to ask a question, put their hand up. If you don't know how to do that, if you look along the bottom of the screen, there's a button called reactions. and in there's a way to put your hand up. So that way we can just try and manage the questions so we don't end up with sort of people talking over each other. Or pop your question in the chat and we will pick those up and answer them as well. So
what we said we'd try and do is alternate between people that got their hand up and questions in the chat. So if you, either way, we really want to hear your questions, if that's okay.
So we've got one hand up at the moment, which is Trish Edney. So shall we, Trish, we'll go to you first.
Thank you very much. Just quickly about Foundry Hub 1. I was a bit confused about the options there of places and which practices.
Yeah.
Just go through that again, please.
Apologies, Trish, and I know it's a difficult one to explain. We have the site on Catherine Road, which is in the middle of the 3 practices that would potentially move there. However, if Pittsmore practice decide not to go forward based on their decision or comments that they've received, that will be a wholly inappropriate practice location for the other 2. And in which case we would build at Sheffield Medical Centre, which is very appropriate for the 2 that would remain. If it's all 3, the only site that is feasible would be the Catherine Road site. So that's why we've just got a difference. So if it's 2 practices, it will be at Spital Street. If it's all 3, it would need to be at Catherine Road around the geography. Okay. Should we take one from the chat, if that's okay?
Yes. We've got a question from Peter Maycott, which is what would happen to the existing practice buildings?
Really good point. We are very clear that what we don't want is a whole range of empty buildings potentially going on the market at around the same time. So we're developing, and we'll work with Sheffield City Council, an exit strategy for those. Because the buildings are in the private ownership of GPs in the main, or of private landlords, we can't say for certain, we can't say it must become X, Y, Z. However, as part of the exit plan that we would have, and the terms upon which practices would exit, I think there is an opportunity to be quite creative, either in terms of creating some open space or development for community use, or it might be that those sites do go for housing. I think in reality, the majority of the buildings are probably not going to be suitable. Some might be converted back to houses if they're originally a house, but the demand for commercial property is quite low. So we're quite keen to have a plan to make sure they're put to best use.
Thanks, Mike. Holly, do we want to pick up one of the questions that's been asked in advance?
Yeah, absolutely. I've got 4 or 5 of them.
Okay.
So one individual I've spoken with this week is a patient of Flowers Medical Centre. Obviously, as you covered earlier, they're part of the Forge Health Group with Pittsmore, and the Flowers site isn't necessarily set to move. But at the moment, they're able to access services at both sites, and sometimes, they can get a GP appointment faster if they're willing to go to the other one. They wanted to know what the changes might mean to them, and obviously that might be the same for some other practices.
I would expect fully that they would be able to access services in the same way as they do, and if one site is better for them than another, they can attend that, or could get an appointment sooner, then that would follow.
All right.
Yeah.
Practices don't. If you are a registered patient at a practice that has more than one site, and the practice doesn't have a separate list of patients for each site. So yes, you can ask to go. You can choose to go to whichever site is most convenient for you. And sometimes practices might ask you to go to one site rather than another. To if a member of staff works somewhere that you need to see.
Okay.
Let me pick up one from the chat. Are all these proposals going to be built through the lift scheme? And I think you touched on this.
Not. No. Lift is fabulous because it's brought a lot of investment that we couldn't have had, but it is not the best model. If I'm being entirely frank, we wouldn't do it now. So lift is not being considered for these. This is being developed with NHS funding, not private funding. And as I said before, the NHS will make a capital grant to the local authority, Sheffield City Council, to build and to operate those buildings. So what will happen is that it will be rent free to the practices. So the rent will be effectively covered by the capital cost. because the NHS puts the capital in to build the building. The council then gives it rent-free back to the NHS, and that's the terms of the agreement. It's a very successful model. It's been rolled out in quite a few areas now. I think there's 18 schemes that are up and running, developed through that across the country so far. Thanks.
Holly, do you want to pick up a couple more that were asked in advance, and then we'll...
Yeah, absolutely. We might be a little bit early on for this one, but I had a chat with somebody who lives in the sort of Firth Park area, so Concord would be their proposed site there. Now they've heard that Concord, the sports centre itself, is potentially being rebuilt, rather than just, an additional building being built. So they wondered if, aside from kind of consultation with GP users, people who would be impacted by the health centres moving, if there'd be any consultation with people in the area, because obviously people rely on Concord for kind of the sports and leisure facilities, and what impact it might have on them.
Okay. So there are plans. Sheffield City Council have got plans, investment plans, which are in the public domain, about redeveloping a number of their sports centres. We are considering, as part of the proposal to develop on that site, to make sure that the development of a new sports centre can also take place while the existing sports centre is still running. And that's just what's called master planning, to make sure that things can fit and that they're considered in the whole. What we're really keen to do is see how those buildings can actually work together. So one of the things that practice in that centre might be able to do is prescribe social prescribing of exercise classes or aqua aerobics, etc., and to really make sure we can maximise some of the benefits of being on the sports centre. I think the other part it brings in is, and one of the concerns being raised is about public transport access to Concord. I think it brings that focal point of services where we can have discussions with relevant providers of public transport to make that a particular route, and that's one we're really keen to work on.
Thanks, Mike. Do you want to pick up another one, Holly?
Sure, absolutely. So there was a concern from one or two people about new sites being built or sites being redeveloped. Obviously that taking some time, and the kind of transition period as GP practices are kind of moving over to those new sites, which I think is especially a concern for people who might have long-term health conditions and kind of need that continuity of care.
Because all the proposals are new build, we're not looking at any redevelopment of existing practices, so we don't expect any disruption of practices until they're ready to move. There'll be a carefully choreographed transition plan when they relocate, and that would be very clear that we'll need to maintain services. And there might be some disruption during the actual move, but there will be an expectation that there'll be a continuity of service.
So if we pick up a couple from the chat, would the new hubs attract new and additional doctors and associated staff?
It's a really good point. We know that across general practice across England, not just within Sheffield, but it is a real issue within Sheffield, of being able to attract new partners because of that need, in very many cases, to buy into a partnership model. It takes away that property ownership aspect of becoming a partner. But there is evidence, and we had a really useful session with the clinical lead from a very similar scheme in London, the Tessa Jowell Centre that was built. And he was very clear that it has really helped them from in a very deprived area in very poor buildings. They can recruit very easily to those new roles now, both in terms of doctors and in other professional staff. The other really important part here is making sure we've got proper training facilities, and that there's a very strong evidence if practices are a training practice and have great facilities for staff to be able to train, they're more likely to stay either as a salary GP or later to become a partner. And equally that applies for other roles of nurse practitioners and many other clinical roles.
I think it's worth adding, isn't it, that we know people will have heard that there is a national shortage of GPs and a number of other groups of clinical staff. So we know that obviously these health centres alone won't magically give us huge numbers more staff, but as Mike said, we hope it makes it a more attractive and potentially more interesting place to work. And alongside these developments, because these are just about the buildings, is all the other work we're doing as part of our primary care strategy in Sheffield and across South Yorkshire, which is looking at how we can improve recruitment and retention, not just of GPs, but all sorts of other staff groups that are increasingly important and valuable in primary care. So social prescribers, care navigators, care coordinators, physios, OTs, a whole raft of nurses, a whole raft of staff are part of that work as well. But certainly having the space to accommodate some of those new roles and having those opportunities to link different services together, we hope will really help make some of these places much more attractive places to work. There's another question about developing other sites. So if a practice chose not to move, is there budget to help them upgrade their existing facilities, or is the budget dedicated to the new buildings?
This is a really interesting point, and one that obviously we've had to work through with practices. The bid that went into central government, what's called the ICS Wave 4 programme, it was a bid to develop new primary care health centres. What we don't have is the ability to say, oh, we decided not to do those anymore, we want to spend the money on existing buildings. I think we would be frowned upon, to say the least. But the actual process we have to go through of a business case is very clear. We have to show what's called a benefit to cost ratio. So there's a HM Treasury set out a process that all public sector organisations need to follow, and we have to follow that to show the benefits that we'll deliver from the hub. One of which is obviously using that investment to produce or to release money that's tied up in paying rent to buildings, and that capital enables us to release all of that cost. Yes, we'll have some increased cost because the buildings will be bigger. They will have significant facilities that we don't have within existing buildings. They'll have grounds for landscaping and things like that that we just don't have. Very modern health centres do cost more to run, so we will make sure that we fund that, and that doesn't fall to practices and make them financially unviable. And we need to release that money. So that wouldn't happen if we just made adjustments to existing buildings.
Thanks, Mike. Holly, do you have any more questions that were asked in advance?
I do have just two more.
Okay.
One of them was about the travel distance, which you sort of touched on earlier, about people who have, mobility issues or maybe other health issues that mean it's hard for them to travel far, and how they receive services if they can't get to a new facility. So, would GPs have to offer kind of more home visits because there'd be more people who can't get there? And is there really capacity to do that?
I think that there is an issue we need to consider around distance. But as I said, accessibility isn't just about distance to travel. It is an important part. I'm not minimising it in any way. And we are very clear the message that we've heard from a number of people. The difficulty is we're not going to find a solution that works for everybody. I think what we need to do is make sure that we're mitigating the impact of that as far as possible. And I know I've spoken to some people who, have family members that are housebound. It doesn't change it for them, but they receive home visit service now in many cases. I think we need to look at how we can mitigate any impact of that, but try and make sure that if somebody does go, they can actually do more in that visit than they might have to go 3 times to their existing surgery. The other part is our existing surgeries were not planned necessarily around where people live. They've just evolved over time. So some people may live closer, and that's what we're analysing at the moment, and that's why we need to get into the detail of it. But absolutely understand the impact, and not just about being on a bus route, but the cost of public transport as well is really important.
Thanks, Mike. Holly, did you say there was a final question that was asked before?
Yeah, looking at it now, though, it's basically the same as one that's already been asked.
Okay. Yeah. So we'll go back to quite a few questions in the chat. I can't see any hands up, so we'll just at this point. So we'll just go through the ones in the chat. Mm-hmm. So a 3-part question about the decision-making process. So I don't know, Richard, if you might want to come in on this one as well. So first part was, when will the decision be made? Then who will make it? What are their contact details? And then is there an appeal process if people aren't happy with the result?
The decision, I mean, there's lots of decisions along the way, because there's several stages to this. There is a consultation, and that's where people feedback. Practices need to make a decision. And that's probably the first of those decisions, is each practice will need to make a decision whether this is right for them and their patients. And I have to say, throughout all of this, in every conversation I've had with practices, practices have been really strong advocates for their patients over and above their own interests. I just want to make that absolutely clear. Ultimately, when the business case is made, it will be considered by the successor to NHS Sheffield, the Integrated Care Board. They will make a decision to support it. They will then need to go to make the capital grant. Ultimately, the decision to go ahead will fall to the Sheffield City Council, because they need to award a contract to build and own these buildings. So there's a number of stages. And also along that stage, there's the issue of planning permission. And you could regard, planning applications for health centres to almost be another form of consultation in its own right, that consulting on whether to build a building or not, and whether the building is suitable. So there's a number of decisions along that process. The integrated care boards are being established in July. So I don't have contact details for them currently, but that's part of their process. And likewise, I think with the City Council, the transition from cabinet to committee structures is underway currently. So we need to be clear about where that decision will be made within the council. We would expect that to be around about November, December of this year. I hope that answers in the round all of those points.
So in terms of the stage we're at now, is that we're engaging. We want to hear concerns and what people have to say.
Yeah.
There will be a public consultation over the summer, where we will do much more extensive and more formal process of talking to people and hearing their views. We need to make sure that we reflect those views in both the plans and any decisions that we or the Integrated Care Board take going forward, and council and everybody else. In terms of an appeals process for the decision made, Richard, is there anything that you'd like to pick up on that at this point?
Yeah, no, I don't think there is anything other than just to reiterate the fact that that this is just the start of the conversation. It was very much this was wanting us to introduce some of the ideas there and understand in the first place what some of the concerns, but also what people need to know and want to know about the proposals in order to make the most informed comments back. So starting, obviously we're committed to go into a formal consultation, which would take spanning over 3 months within the summer. So there will be plenty of more opportunities for people to be involved in that. So that's pretty much, I think, all I want to add to that.
Thanks, Richard. The same person's just made a comment that said, just put a comment in as well, that they said they wanted to put their views about the proposals because it affects their practice. But the questionnaires they felt the questionnaire was a bit prolonged in terms of answering all the questions we wanted to ask people. Richard, I think we'd be really happy if people we'd be really happy to receive any comments at this stage or later. Have we got, I can't remember off the top of my head, have we got a separate email address, or is there an email address that you could put in the chat if people do want to just email us a message to, you know, to get across what they're thinking rather than fill in the questionnaire.
Absolutely, yeah. I mean, we don't have a separate email address. It's a generic email address for the CCG, but I'll pop that in the chat. But obviously, you know, we also have the 3 community organisations who are more than willing to receive conversations about it. And we know that Healthwatch have really supported us as well in terms of listening and feeding back to us what people have been saying. And equally so that, you know, the survey, people don't have to answer every single question, and if people feel that they don't want to ask certain questions for whatever reason, that's absolutely fine. There are a few different free text boxes for people to write in any comments that they would like, and we read through every single one of those comments, whether you know it's in the right place or answering the right question. We'll take the information that's written in there. So I just want to kind of really encourage people to feed back in any way that they can, and we will listen to however that comes back.
Thanks, Richard. We've got a hand up. Norma, would you like to ask your question?
Yes, basically, I just want to know, will the relevant GP practices be doing any consultation with their own patients, or is all consultation done through the CCG?
We are doing the consultation we are doing the engagement for the practices. We will be doing the consultation as well, but there will be opportunities within the practices to have those conversations. So we're talking to practices. Some of the practices are really keen to have sort of talking tables where, you know, where there'll be an opportunity for patients who are using services just to talk to somebody or to drop their comments in. But obviously, as you can understand, it's quite a big thing for the individual practices to take this on, which is why the CCG is supporting the practices by doing some of this work on their behalf, because we've got the expertise.
Okay, that's fine. I'm just a bit concerned that the most vulnerable patients aren't going to get to know about this. No. The only way they'll get to know about it basically is through the GP. But if I'm assuming, I've not been to my GPs for a while, but I'm assuming that there's notices up in the surgery that gives them an opportunity to have their say.
Yes, and we've asked all GPs obviously to write, to text all their patients or write to them if they don't have mobile phone numbers for them, to let them know what's happening. Okay. And during the consultation, you're right, we'll be making, you know, every effort we can to reach as many people as possible during that consultation. Okay. And the consultation, I'm pleased to say, will run for a much longer period, so yes, we'll have much, you know, a lot more opportunities to make sure we hear everybody's views.
Okay, thank you.
Thank you. So just back to the chat for one. Does the 37 million have to be spent on building new buildings? I.e., if the proposals don't go ahead, the city loses the investment, or are there other ways we could spend it on improving health services?
I think similar to the previous question, we do have to spend it on that because that's what the bid was made to central government. We don't have that ability to say thanks for the money, we'll spend it on something else. So we would lose that money if it wasn't spent on these proposals.
Thank you. And Louise, ask you.
Yeah, I just a couple of questions really. I'm talking to a few of our ladies and gents who use our services, and although they do have mobile phones, they don't have data plans on them. Yeah. So they've been receiving text message. They've received a text message from the GP surgery asking them to give their opinions on service changes that's happening, and it's got a link in the text message. But this link, they cannot connect because they don't have data on the mobile phone. So that means that they come to a dead end at that point. A couple have mentioned it to me, so I've actually given them the paper forms and they've completed the paper forms. But it's the people we're working with coming across this issue, then obviously there's going to be a lot more people coming across this issue, and especially the older generations that just use their mobile phones for calling and texting. So it's all right, GPs having mobile numbers on patients and sending these text messages out, but it does not mean that these people are going to get their opinions across, because if the links aren't viable for them, they're not going to work. So that really needs to be considered. And also, our communities over the years have kind of been decimated through stuff like supermarkets, and bigger's not always better. So, for example, we used to have as butcher shops, we used to have as hardware shops, we used to have all as local services. And over the years, we've had places like supermarkets come in. And the consequences of that means that now all our local communities have lost these resources. So, for another example of this is going to be once all these GP mergers happen, then our chemists in our communities become not viable anymore. So what happens to that shop again? So that's eventually going to become another bacon shop that becomes a burger shop, or a pizza shop, or a kebab shop, or again another empty building on our communities that are already struggling with empty buildings and stuff. So, and people lose their jobs in chemists. That's it.
Okay. So first, thank you for your first point. It's a really good point. Obviously, we have, for the engagement, also been working with community organisations, and hopefully some people who maybe couldn't use the links have been able to get paper forms or feedback through those routes. But I think that's a really good point for the consultation on how we, if we are trying to communicate with people by text, we give them other options to get engaged rather than just a link. It's a really good point, thank you. And then on the point about the impact on communities and the local area, Mike, I know this is something that we've talked about.
Absolutely. Our dilemma in this is, yes, how much people value and use their local GP practice, whichever that might be, but we just don't have the ability to be able to deliver modern healthcare in all of the buildings. And they won't be fit for the future to deliver the wider range of primary care that is expected to help people stay well, keep living well, and keep out of hospital, away from hospital. So it is a difficulty that we just can't provide everything in every building. And that's the dilemma. And it's very much why we're asking people, what do you think of this? It's not that we've got all of the answers. We want to hear what those concerns are. In terms of pharmacies, it is a separate process. It's led by NHS England for pharmacies. And there's obviously that point around, should a pharmacy be part of a new hub? If it's got existing pharmacies within the appropriate distance, then no. And I think that's something we do need to take into account. But we're really trying to, give a platform here, an investment that is much needed in the communities to better healthcare facilities. It doesn't solve every problem, or it creates a really strong platform for delivering, but there might be some downsides for some parts, and we want to try and minimize those.
And I think on a sort of related issue about scale, we have heard comments about people feeling that a bigger new community centre won't feel the same. They'll lose that sense of community, and that's something I think we're really conscious that can and should be addressed during the just sort of as we plan the developments, isn't it, Mike?
Yeah, I think the difficulty is if we don't have this opportunity, we don't take this, and there's a genuine, if people say no, then it won't happen. How do we improve healthcare facilities in the communities? Because the national direction is for larger primary care facilities, primary care at scale, and actually what we're proposing is on a smaller scale than the national picture, where they're looking at much larger buildings providing the healthcare needs of an entire primary care network, 30 to 50,000 people, whereas we'll have 2 in each network, plus 2 lift buildings, the existing buildings. So we're not going for the very large scale building that is being proposed and is the national programme elsewhere in the country. We don't think that's right for our communities.
There really is a tension, isn't there, between the encouragement to sort of develop services at a local scale and the ability we have to accommodate those at the moment.
It's a very frequent tension and dilemma within healthcare services of, do you provide it as good as you can locally, or do you provide excellent a bit further away? And I think that's a really difficult decision.
So a couple of specific sort of site-specific questions or about practices, Mike. What's the rationale for Melrose surgery allocation? The person who's asking presumes it's the main site's location rather than the branch site.
Yeah, what we've done is modelled, if, for example, Melrose as a smaller branch, and with it's actually used, I believe, in some circumstances more for primary care network. So this is a bit of I would say an overflow, but what we're trying to do is model those patients that would normally attend Melrose surgery, and we've done this for some other branches, as I mentioned, with Herries Road, into which is the nearest hub for where those patients live. And because we don't have, people don't register for a main and a branch separately, what we're trying to do is look at which postcodes people live in, registered with that practice, and model it into the nearest hub. Again, I mean, we're talking relatively small numbers of patients, and when we're doing the modelling, that we know that some people may decide, well, that hub's a bit closer for me, or that suits me because I go to X, Y, Z. I go to Asda and I can go there at the same time. So people may have some flexibility within that, and where we're looking at a branch being distributed across potentially across a number of hubs, we're talking the hundreds of patients, not the thousands. So the building has got that scope, and we've built for growth within the areas, population growth too.
Thanks, Frank. And the second one was, has an adaptation of Sorby House on Spittal Hill been considered?
Yes, I know Sorby House well. As I outlined in the presentation, we considered 37 buildings, and then we went to 28. Sorby House was one of the 28 that was scored by the practices, by the City Council and by the NHS Sheffield. I can't remember the precise details. I don't think it was actually big enough because the top floor is a smaller footprint, and there were some also existing commitments that we were not able to change within that building. But it's in council ownership, and in many ways could have been a great location. And where we're looking at Catherine Road is, that was that hub that we were considering.
Thanks,
Foundry Hub 1. Yeah.
Thanks, Mike. There's a comment there about Sheffield Medical Centre site being up the hill, and people and it might not ever be on a bus route. So we'll feed that into the comments. Yeah. So who would manage the hubs? That's the next question.
Well, this is interesting because what we're very clear of, this is not a lift building, and lift buildings are managed by the lift companies. And whilst they would be in the ownership of Sheffield City Council, what we're proposing is the GP practices form a building user group, and they have a very strong say in how services are delivered and what goes on in them. In terms of activity within the buildings, absolutely the GP practices working collaboratively within the hub. In terms of deciding who does the grounds maintenance and who does the cleaning, that's again with the practices to decide whether they want that to be delivered by the council and using their in-house services, or whether there's somebody that they think is better value. So it's not lift, and it's not prescribed, this is a service and take it or leave it, or take it in those buildings. Yeah.
So a slightly different one now, about the plans for the build and sustainability. Will solar panels be part of the hubs? Oh,
very much. So there are a number of conditions that were given to this funding from central government that have come through. And one of them is about the environmental credentials of the building being what's called BREEAM, Building Research Establishment Assessment, excellent. So they wanted that very highest rating of environmental accreditation. We're actually going a step further because Sheffield City Council have a policy that their new buildings should be net zero carbon. And that's a phrase you'll start to hear more and more often. I believe they will, if we build them, they will be the first net zero carbon buildings within Sheffield. So they will have solar panels, they'll have rainwater harvesting, they'll be of a very high level of thermal insulation. They won't have gas supplies, there'll be no gas to them. It will be heat pumps, underfloor heating, etc., run from solar panels with battery storage. In anything that we can't generate on site as part of the building being self-sustaining in its energy needs, will be imported from renewable sources only, so net zero carbon buildings.
Thanks. Question about what we were talking about in terms of practices and what, the practices that are considering this. So can a GP practice unilaterally say no thanks, and that has to be accepted? The example was Norwood Medical Centre, for example, has communicated they consider a merger not to be the preferred option. So I think the first thing to say is that we are not, probably just terminology, but just to remind people, this isn't about practices. This isn't about practices moving and merging to form one big practice.
Co-locating.
It's just about them co-locating in buildings. So there is no expectation that practices will merge.
Norwood have said their preference at the moment is not to co-locate and move to the hub, that they want to stay in their existing building and hopefully expand it. And that's been their position. Actually go back to 2017-18, they've always maintained that, and from the very first feasibility studies that were done before a bid was even put in. But yes, a practice can unilaterally say no thank you. So there's no compulsion. We don't have a button within the NHS Sheffield to make anyone do that. What we like, and I genuinely believe that practices are wanting to hear people's, patients, communities' views to help them make that decision. It is a very difficult decision for them, that there's an opportunity for investment. There's an opportunity for releasing some of the money that we pay in rent on old buildings to move into a building where we don't have to pay rent because it's been paid for by capital funding. That releases a lot of money and they get better facilities. And it's a really difficult decision for practices, but they have to make that decision. So we'll only go to consultation with a firm commitment or plan from practices that they want to consult on that proposal. If a practice says, thanks, but no thanks, we're going to stay where we are, it won't go to consultation. That is the process.
Thanks, Mike. So likely timescales, and we touched on this a bit at the end of the presentation, but just outlining what the next steps are and how this will progress.
Yeah, so we'll be, we obviously need to collate all of the information from this process that closes on Sunday. If somebody comes with a late comment, I'm sure we'll build it in, but I think Richard and the team will be doing the analysis of that. There's then a process where we need to share that with practices. We need to consider what that means and meet with practices about how we might modify proposals, and we need to work that through. I think what we're looking at the moment is that consultation will be in early summer, running through into perhaps end of September. We haven't pinned those dates down. It'll be a minimum of 10 weeks. It might be a little longer. I don't think that's been fully confirmed because we just need to understand what the extent of feedback is. There will be a number of processes that need to happen concurrently. So the target that's been given by the government, one of the conditions to this funding is that buildings are open by, or completed, I should say, technically, completed by December 23. So we are 18, 19 months away, something like that, which is a tight time frame because we've got a lot of design work to do, we've got planning to do, and there is a 12-month construction period. So we really need to be working that back to consultation completing in September, taking on board any comments and adjusting designs and proposals, seeing whether we do have viable schemes. What the outcome of planning permission applications would be is another key part of that. All of those things need to align with a view to the business case being approved by the NHS in December and going to NHS England, and also for the council to be considering that around about the same time frames as well. So there's a lot to squeeze in, and that's why we really do need to make some progress on some of these issues.
Thanks, Mike. So the last couple of questions on the chat are about similar things. So if I sort of read them both out and we can pick them up. So the first one is about, can the money be used on existing GP surgeries to employ more GPs so we can get to see a doctor quicker and the process to contact our GP surgery easier? Yeah. Why create more places for potentially creating more problems when the current problems aren't being fixed? And the other one is, one of the biggest issues I find is being able to get an appropriate appointment to see a GP, how would these proposals affect that?
Okay, I'm afraid there is a reason why the money that we will get to build buildings is a one-off lump sum. It's called capital. It's the same as building roads or schools or whatever. It's a one-off lump of money. It is not the money that we can deploy year after year to run the services. That's called revenue. So there are two forms of funding. We've got the one-off funding, and one of the conditions is that the new buildings are affordable within existing resources. So we need to release the money that is tied up or paid every year for our old buildings, and that goes towards paying for the new building. So there's a significant overall saving for that. It does release some money, and what we've said is, and we propose, we need to go through our various approvals processes, is that money will be used to help reduce health inequalities, to improve services. The issue about getting an appointment is a separate appointment. One of the things that we do know is that a lot of practices tell us that they don't have the space for all of their clinicians and their teams and some of the extended roles. We know that there's been a lot of pressure on primary care, a huge amount of pressure, and it's been very disruptive over the last 2 years. What we want to make sure is we've got the buildings that provide the very best level of service. We want to give much money tied up in buildings back to services to help deliver that, and that in turn helps with being able to recruit and train workforce. So I think if we have better buildings, there is evidence and there's a lot of research into how buildings affect people's well-being as members of staff, that reduced absence and illness, reduced ill health, improved retention, less locum use because you're able to recruit. All of that has a cumulative effect on making or improving availability, and also having the right facilities to be able to work at, because one of the problems we have is a restriction on clinical rooms, and we will make sure we've got the right number of clinical rooms. So I can't make a promise that, this is about service redesign. It's not just pick up what we do in a building, put it into a new building, hey, it's all going to be better. It doesn't work like that. We need to work with practices on how we redesign and get the very best out of this investment opportunity to deliver the best services that we possibly can. And I know that is the desire of practices.
It's just to enlarge on that a bit. Yes, we know it's not building new buildings will not automatically improve the health services, but it does give us the space and some of the opportunity to work on changing the services that are currently in place. And this sits alongside our other plans for primary care. We know that, we know that in Sheffield and a lot of other parts of the country, people are struggling to get in touch with their GPs to start with, to get GP appointments, and that is really difficult and it's not acceptable. At the same time, GPs are struggling to actually, as Mike said, create enough capacity to see everybody who wants to see them. So there are other things that we are doing at the same time and will do longer term. So over the winter, we've created some additional appointments with nurse practitioners and a GP home visiting service to help support demand. We are looking at projects that will, if they can go ahead, will potentially create some more space in other practices by moving hard copies of clinical notes into secure storage, and also working with practices who are struggling with their current telephone systems to be able to upgrade those to better telephone systems with more lines, better call queuing and full and ring back facilities, so patients don't have to sit on the phone for ages. And also they have online facilities so that GPs and other staff can work from home if they need to, if they're sick or they don't have space to do their work from home. So there are a whole range of other things that we are looking at alongside this to try and improve the experience that patients are having at the moment. There's just one final point, Mike, from someone. All the schemes to be completed by December 23 means concurrent builds and added cost. I don't know if there's anything you want to say about that. In
part, it's right. It does mean concurrent builds because we expect that the city centre will be a conversion of an existing building rather than new building if we're part of the high street. But the 4 new builds actually concurrently is reducing cost. we're using what's called modern methods of construction. And there's a number of examples of this, of the model that's used. It's a framed building, and there's a lot of benefits of actually having those phased, depending on the extent of groundworks, and for teams to work across those four sites. So our construction partner that we would be working with and we're developing proposals with is actually indicating a lower cost from having 4 schemes in close proximity.
Thanks, Mike. I've come to the end of the online of the questions in the chat. Does anybody else have any other questions or comments they want to raise? We're nearly spot on time for what on the dot for what we said in terms of timing this meeting. And if there aren't, Richard has put the email address in the chat. So if people do have any other comments or feedback, it's there. It's sheccg.coms@nhs.net. So do feel free to, give us any other views, questions, comments you've got. And obviously then watch out for the news about the consultation when that begins fairly soon. If there's nothing else anybody wants to say, I'd just like to thank everybody for taking the time to join us this evening, and for being for making it such a success. It's really, online meetings are really difficult, and you've made it. You've been extremely helpful and respectful of everybody's, giving everybody space to ask questions. So thank you very much for making it so straightforward for us as well.
Thank you, everyone. Do appreciate it. Bye.
Thank you.
Thank you.
Goodbye.
Thank you.